Hello, thank you so much for joining us today. My name is Laura Burbano. I am the admissions advisor for the Sport and Performance Psychology programs and the Clinical Mental Health Counseling program. So thank you again for joining us today. So I'm going to share my screen so that we can sort of like see the agenda for today's event. So we will have today an informal conversation with Dr. Michelle Cox. She's the program director of our mental health counseling program. And we will also have an informal conversation with Dr. Sarah Castillo. She is the program director for the Master's in Sport and Performance Psychology, the Graduate Certificate in Applied Sport Psychology, and the Doctoral degree in Sport and Performance Psychology, non-clinical track. You are in listen-only mode. Please ask questions by typing them in the Q&A box. We will try to address as many live questions as we can from the audience today. But if there is any question that, unfortunately we cannot go through, please feel free to send an email and we will just reply. If after the open house, again, as I mentioned before, you did not have the chance to ask your question, you cannot only send your question via email, but you can also schedule an advising appointment one-on-one with me. So let's start today. So I'm going to ask Dr. Sarah Castillo and Dr. Michelle Cox to please unmute and also to join me in the virtual forum so that they can introduce themselves.
Wow, as soon as I unmute, of course, you get the chorus of dogs. You all will learn that between the two of us, Dr. Castillo and I have 5, which is unfortunate and exciting and happy. Hers are as adorable as mine, maybe as adorable as mine. Thank you all for joining us virtually as we spend some time introducing the programs to you. We're really excited to have you. We understand this is sort of a big audience today, so thank you for being here. We're going to be attending to your questions and the ones that we generally get as we do these open houses, so hopefully we'll be able to answer a lot for you. Hi, I'm Dr. Michelle Cox. I'm the director of the CMHC program, Clinical Mental Health Counseling program here at UWS, and I'm looking forward to today.
Hi, everyone. I'm Sarah Castillo. I'm the director of the Sport and Performance Psychology programs at UWS. And luckily, my dogs right now are asleep under the desk, but I have every expectation that they will wake up and interrupt as much as possible later on. So stay tuned. Thanks for joining us today, everyone.
Yeah, so now we're just gonna just start the conversation, basically. So Dr. Michelle Cox and Dr. Sarah Castillo. So we have this wonderful doctoral program with a combined degree in clinical mental health counseling. And we also have our doctoral program, the non-clinical track, that has the 2 concentrations, one in positive leadership and administration, and then the other one in sport and performance consulting. So we're very excited to sort of like introduce to the audience a little bit more about what these concentrations are. So if you just wanna just take the room and explain a little bit like what are these concentrations, in which cases students should go for a particular concentration, and what will be the professional outcomes expected.
Sarah, why don't you start with CMH or with SPP?
Yeah, so one of the very cool changes that we've made beginning fall 2022 for our doctoral program is that every one of our students will be completing an individual research project or a dissertation. That wasn't the case before, and that was actually one of the challenges in our program, because in order to secure an academic job, which is where a good amount of our students are looking to work and where a good number of jobs in our profession are, the completion of a dissertation is sort of an entrance requirement to being faculty at a university. With our students not having that completed, they were essentially kind of locked out of those positions. And that forced our students to make a lot different or a lot more challenging career paths than they needed to. So instead of choosing mentorship or dissertation, now students have the ability to do both. So everyone coming into our doctoral program in either the integrated degree with clinical mental health counseling or the standalone SPP doctoral degree will complete a dissertation and have the opportunity to choose between concentrations. For students in the integrated degree and the standalone doctoral degree, both of those groups of students will be able to choose the sport and performance consulting concentration. And that's essentially a year's worth of mentorship. You'll go through, complete a pre-practicum, pre-mentorship sort of course in which you'll be able to work using our standardized patients to get some really good hands-on experience working with a client in a way that's incredibly safe before you get out into the world and start getting into the heads of future clients. You'll get a good amount of feedback. The clients that you have are standardized patients who are actors, will provide both you and us as your supervisors and mentors with sort of their feedback on how you did. And so really during that term and that course, you'll get a whole lot of information on how to hone your skills and how to get a whole lot better at that consulting expertise. After that, you'll have 4 terms of mentorship in which you'll learn how to approach a site, how to secure that sort of mentorship or internship experience, and then be mentored by someone who is not only a certified mental performance consultant through the Association for Applied Sports Psychology, but also on that registry of approved mentors, which means that all of the hours that you do, that you get mentored at University of Western States will actually count toward getting that national certification. So the sport and performance consulting concentration is really for those who want to get their degree and then be able to do both academic work as well as performance consulting. And to be honest, that's a decent portion. I mean, that's what I do. That's a decent portion of our professionals. Academic work and then the ability to do that consulting either on the side or as a 50-50 sort of position. A good friend of mine is at Cal State Northridge and actually has that role. She's 50% academic and 50% working in the athletic department. So that's one of the big positions out there that now our students are actually being trained to manage as well. The other concentration is our PLA, or our Positive Leadership and Administration. That concentration is only open to students in the standalone EDD degree. So clinical mental health counseling doctoral students are not eligible for that. It's too many courses. You don't have enough room in your schedule to complete the PLA concentration. PLA really is designed for folks who want to continue their work in coaching, who want to go into administration and leadership positions, things in human resources, things in again, athletic administration, athletic directors, associate athletic directors for performance, all of those sorts of pieces. We have a lot of folks that are coaching directors who work at Positive Coaching Alliance, those sorts of folks that are getting their doctoral degree to really expand their knowledge of sport and performance psychology, but then want to make sure that they have a lot of that positive leadership and administrative experience to motivate larger groups of people. So either teams, larger organizations, folks working in corporate settings. That's a huge piece too. So those 5 courses are designed to really integrate the principles of positive psychology with applied leadership interventions. So how do we make entire groups of people more functional and more effective in their work?
Thank you so much, Dr. Castillo. So now we're gonna go on to explaining a little bit about the doctoral degree with the specialization in clinical mental health counseling.
Well, let's just start off by saying that we offer a fairly traditional master's degree in clinical mental health counseling, the same kind of core competencies that you would traditionally see in most other master's level programs. We have some distinct and unique differences, and I want to say advantages to that program. then we can talk about those, what makes our CMHC program unique. But probably one of the most specialized degrees I have seen in my experience as a counselor educator is the integrated degree, the EDD in Sport and Performance Psychology with Clinical Mental Health Counseling Specialization. In essence, the first 2 years or 90 credits of the degree is that CMHC Master of Science degree that the majority of our the students and applicants who are listening can take to their state licensing boards and apply toward licensure. Once that degree is conferred, students then move immediately into their doctoral work in sport and performance, where they can continue to choose a mentorship as an elective and are required to participate in the doctoral dissertation portion of the degree. It's what we're seeing as trending in the field in terms of employment opportunities. Whether or not we would like this to be the case, what we're seeing is that a lot of employers are looking for duly credentialed individuals to fill their sport and performance consulting role and a clinical mental health counseling role. Now we have some very strict and stringent requirements that meet ethical standards and professional identity in each of those areas, and we teach to our ethical codes all the time. But what we find is that in the field, this dual degree is the thing that is trending. This is what, and we were a little bit ahead of that curve. And then bringing in Dr. Castillo a year and 3 months ago into the programs have just really heightened the value of this degree because she has her pulse on what is really required in the field in terms of sport and performance psychology and consulting. So it's a really unique degree. We're really pleased with it. We work very well together, collaborate well together. All of our programs are collaborative. Our courses are collaborative. We're constantly attending to what one of our programs changes does to the other program. And our students are engaged together in their courses and in their programs. And so we find it a very collaborative, interprofessional oriented process here.
Thank you so much, Dr. Cox. So one of the questions that I typically get from applicants is in regards to licensure requirements. So as most of our applicants already know, the combined degree allows them to apply for the LPC license, but also for the CMPC certification. So the main concern that some of them have is like how the licensure process works for them. And because our master's is not necessarily accredited through CACREP, if there is any hindrance for them to obtain that licensure. So yeah.
Yeah, it's a wise question. Folks asking that question are being thoughtful about the licensure requirements in their states. A lot of people entering into a counselor educator program do not recognize that licensure laws and rules are not the same in every state. There is no national licensure for counselors. That means that we are at the mercy of whatever state we live in to determine what degree requirements they have. What we have done when we designed the program, recognizing that we wanted to pull students from as many states as we possibly could in the United States, is we designed a program to meet CACREP standards, meaning what core courses and competencies are required by the gold standard accreditor in our field. And then we actually looked at all the various state licensure requirements in terms of academic programs and designed our requirements to be, for the majority, higher than what were required. So we made sure that we included core courses and the content that was required in those core courses. Some states require additional courses, for example, some in trauma, some in human sexuality counseling. We have those as requirements in our program. And then a big requirement is the number of clinical hours a student has to earn while they're in an academic program. And we set our bar a little higher than what the average requirement was so that we met the majority of state laws and rules. Now, that said, there has been for, I would say, half a decade or more, a push by CACREP, the CACREP accrediting body, to try and get as many states to move toward CACREP only acceptance, meaning they will only accept students who have graduated from CACREP accredited degree programs. And there are a few states now who have adopted those laws and their future laws. I think Florida's one of those states, and I believe they start in 2025. So we have some Florida students, but they'll graduate before that CACREP accreditation requirement comes through. Part of our responsibility as an online program is to help students work their way through what their state licensure requirements are. And so we do that here in the program. One of the first things I look for in an applicant is what state they live in, so I can do a review of their state licensure requirements just to ensure that our program can tuck neatly into those requirements. We are regionally accredited, and that is what is required by most state licensing boards. In addition to that, though we originally thought we were interested in pursuing CACREP accreditation, and we respect their process and their standards, what we decided is that their holistic focus on just counselor educator or counseling as an identity, as a professional identity, was too narrow for us. We just spoke about the unique components of the integrated degree, where we emphasize both the value of clinical mental health counseling and the value of sport and performance psychology and consulting. And an accreditor called Mpcac will accredit programs that focus on both. In other words, they are an interprofessional accreditor. And so we're in the process of pursuing Mpcac accreditation currently and plan to be submitting a self-study this fall for that accreditation. Long-winded explanation to say we cover most states, but you know, we always want to check.
Yeah, thank you so much, Dr. Cox. So the next question is more like an open question for whoever wants to address it. Is mostly in regards to the differences between a licensed professional counselor and a certified mental performance consultant, and how these two specific, like license and certification, are complementary to each other. That's basically the main question, so that our audience can understand the difference, and whether or not in like working with a particular client, they can use both hats or just one hat when they're working with clients.
So to the first question, the difference between certification and licensure is essentially that licensure is a credential granted on a state-by-state basis. So being licensed in Oregon does not automatically mean you're licensed in Washington. Certification is a national identifier. So, and that's anywhere. So if you are a certified strength and conditioning coach, that's a national indicator. But if you're a licensed mental health practitioner, you're licensed in a particular state. There are certainly reciprocity laws for licensure, but it is far beyond my knowledge to figure out if you're licensed in New York, does that mean you're also, you know, is there reciprocity with New Jersey? I don't know that. That's a state-by-state thing. Excuse me. In terms of how they're complementary, that first answer probably helped to give you a little bit of that. But remember that the national certification is in performance psychology rather than mental health or clinical counseling. And so being nationally certified in performance enhancement and mental performance consulting really gives you the opportunity to demonstrate competence in the performance psychology, mental performance, mental toughness side of things, knowing that athletes are complete people and have sort of complete, right, pieces of humanity. So you're going to encounter athletes who have both performance issues and clinical mental health issues, or one or the other. The great thing about being dually trained is that you are certainly able to take on clients that have either issue or both issues. What we talk about and what becomes a huge ethical consideration is that in no way, if you are clinically licensed and nationally certified, are you able to treat the same client for both things. That falls into what's called a dual relationship, which is specifically prohibited by every ethics code that we've got, both on the sport and performance side and on the clinical mental health side. So you would be able to take clients who have performance issues and have that national certification and be able to work with them on goal setting, imagery, self-talk, managing competitive anxiety, et cetera, or you could take on a client that came in with clinical anxiety, depression, eating disorders, et cetera. But again, if you're working with a client who came in and began their relationship with you with clinical depression or clinical anxiety, generalized anxiety disorder, and then presented as wanting to do some goal setting work or some self-talk intervention because of a performance issue, those particular things, because you have a pre-established relationship in a clinical setting, you are referring those performance issues to another certified practitioner, and vice versa. If a client walks into your office and presents with performance issues and that becomes the nature of your relationship, then if and when any clinical issues present, you're going to refer that out to a different clinical practitioner. So you can take both, but you're never doing both with one person. And I'll let Dr. Cox correct me if I said anything incorrect there.
When do you ever say anything incorrectly? No, my answer to that question is really fairly simple. We have a manual in our field called the Diagnostic and Statistical Manual of Mental Disorders. It is all the mental health diagnoses that you could ever want to know about and lots that you never want to know about. And what we do as licensed clinical counselors is assess, diagnose, plan treatment, and treat mental health disorders. That is our entire focus as clinical mental health counselors. And part of a significant portion of our job is to teach you how to do that, what the process looks like, what information you need to be able to do it, and how to approach that type of clinical relationship with clients. I think a lot of students come into our integrated degree sort of assuming that if they can earn a clinical mental health counseling license, then they can also consult. And we want to clarify that we have significant respect for both professions and both the license and the national certification as a CMPC. We don't ever train our students that, oh, if you happen to be getting a clinical mental health counseling degree, you can automatically just go out there and consult anytime. Consulting requires an expertise too, and specifically sport and performance consulting requires expertise. That's why there is an EDD degree in this subject matter. So they are vastly different. There are some overlapping skills and knowledge points. And part of what makes our program unique is that we really focus on helping students understand how to determine what is really a consulting role and what is really a counseling role, and to make sure that they're following those ethical codes very carefully.
Thank you so much, Dr. Cox and Dr. Castillo. So the next question has to do specifically with our Masters in Sport and Performance Psychology and the concentrations that we are offering. So for the audience, we are offering a concentration in applied practice and then another one in positive coaching. So Dr. Castillo, I'm just going to ask you to please explain to the audience what is the difference between the two concentrations and whether or not students will be able to meet some of the mentorship hours and through which concentration.
Got it. So in the master's degree, we have the applied practice concentration and we have the positive coaching concentration. Both of those are also separate concentrations, and they sort of mirror the doctoral concentrations I explained earlier, the positive leadership and administration, as well as the sport and performance consulting. Students are able to choose one or the other. There won't be the opportunity to kind of complete both within the confines of the program. You're always able to take additional courses, but the program is 54 credits. And so it's only 54 credits that ends up being covered by financial aid. So you would essentially be doing the other concentration if you wanted to do both as sort of a non-degree student. The positive coaching concentration in our master's degree is a combination of courses really designed for folks that are working hands-on with athletes. So completing your master's degree and wanting to work in coaching situations, maintaining the career that you have, figuring out how to motivate, how to work with performers in a way that, again, incorporates the principles of positive psychology and positive leadership in a way that's more directed at athletics and athletic involvement. The applied practice concentration is actually one of the ways that our master's program newly is able to give students a way to start meeting those mentorship hours for national certification. We saw a question already about whether or not you could achieve national certification with your master's degree. The answer to that question is yes. The challenge there is that master's programs across the country, this is not just a UWS thing, are too short for students to be able to complete all of the required mentorship hours. That's true in clinical mental health counseling as well. You can get the degree and you can get all the coursework done, but there's no way you're going to finish all of that supervision within the confines of an academic program. What our new master's degree does is allow students in this concentration to actually get some of that mentorship experience out of the way. So you're not graduating and starting fresh once you leave. You actually have a couple of terms of that mentorship experience that I talked about in the sport and performance consulting concentration at our doctoral level. Our master's students who choose this concentration will actually be in classes with our doctoral students. That gives us a really good opportunity to have some sort of peer consultation and really allow our students who have been at it for a while in the doctoral program to provide a lot of help and a lot of sort of shepherding through, here's what the process was like for me, and here's something that might work for you. Again, the students will go through sort of how to find an internship, how to engage in the process of starting to work with clients and performers, and also have a full quarter of that mentored experience from a CMPC and a registered mentor. The good news about that is that in any of our concentrations and any of our sort of mentorship, the sport and performance consulting or the applied practice concentrations, UWS pays the mentors. So you're actually enrolling for the course and the fee for mentorship is paid as part of their teaching contract. When you're out of an academic program, professionals that provide mentorship charge. They generally charge by the hour, and usually it's the same as the fee that they would charge for an actual session. So if somebody charges $250 an hour for a session, they're going to charge $250 an hour for mentorship. So rather than that coming out of pocket, our applied practice concentration allows the university to pay that and sort of takes care of that in lieu of you having to pay for your education and then start paying for your mentorship. Hope that helps.
Yeah, that's absolutely helpful. Thank you so much. So the next question is specifically about our graduate certificate program as well. So oftentimes I get questions from applicants regarding what is this program for? The graduate certificate in applied sports psychology. Is this program for somebody who is just interested in learning a little bit about the field and they're not sure if the field is appropriate for them, or is this something that could be used as a professional development kind of program? So I'm just gonna let you answer that, Dr. Castillo, as well.
Well, the short answer is yes. I'm assuming you want a little more. One of the cool things that we've done with our graduate certificate program is actually opened it up to students who have a master's degree, a bachelor's degree rather than just a master's degree. And so that's actually the answer to the first part of it. A lot of times students are graduating with their undergrad degree and weren't that sure if they liked college in the first place, but they really think that sports psychology is cool, but they don't know if they want to do it or if they can do it. So that certificate is available really to help you figure out, is this something that I really want to invest in? Is this a field? Is this something for me? And so what you'll take is 7 courses as part of our certificate program. And those courses will be able to transfer in to, excuse me, to a master's program, or 6 of those courses will be able to transfer into a master's program if you continue going forward. Certainly, you don't need to complete the entire certificate before you make that decision. If you take 3 classes toward the certificate and think, oh my gosh, this is for me, I've got to do it, you can immediately apply for that master's degree, and any courses you've taken in the certificate will move over. Or you can complete the certificate and see how it goes and then decide from there. For professional development, certainly that's an option as well. We have plenty of folks who are clinically licensed and really want to expand their practice into sport and performance psychology and really understand what the differences are and the contextual differences are between athletes and performers, and the average person that comes to a clinical mental health session, what the contextual differences are, what the issues or challenges are a little bit different. And so rather than getting an additional degree, those clinical professionals will simply expand their competency and complete the certificate that way. So they'll have all of their mental health licensure continuing on, and then they'll be able to really understand a lot about the sport and performance aspects of it. One of the things that the APA requires is that you can't just call yourself a sports psychologist, right? Being a licensed psychologist allows you to call yourself a psychologist, but the APA and their ethics code actually requires that individuals have to demonstrate a competency in order to use that word sport and start doing sports psychology interventions with folks. And our certificate is one really great way to gain that additional competency.
Thank you so much, Dr. Castillo. So Dr. Cox, now the following question is in regards to why is it that we are not accepting international students in the combined degree? I have some people in the audience actually joining us from Singapore and from the Philippines and from Australia. So if you can please go ahead and explain why is it that there is a restriction for applicants to get into the combined degree.
Yeah, we love you. We're appreciative that you're here with us at the open house. So thank you from very far away. We have absolutely no ability to monitor your clinical internship work when you work internationally. Every nation has laws and rules. There are many nations that don't come anywhere near having the laws, rules, and ethical codes that we have in the United States in terms of clinical mental health counseling. And it's difficult enough to manage all the requirements of the 50 states, but at least we know that there's similarity among the 50 states. But once we start getting into other countries, we have absolutely no control and no relationships, by the way. I was just writing a response to a question about the SPP programs in which I was talking about the importance of relationships with the mentors in the field. Dr. Castillo and her amazing cast of instructors, they have built relationships with their peers over time. They know expert after expert after expert who will mentor our students. The same is true for our folks in clinical mental health counseling. We have instructors and clinics all over the United States, and we just don't have the ability to develop those internationally.
Thank you so much, Dr. Cox, for that answer. So the next question is specifically from somebody who has already a license in social work, and this person is unsure whether, what way to go. If he needs to go for the combined degree, perhaps, or if he needs to go for the standalone doctoral degree or the graduate certificate in order to gain some expertise in the field of sports psychology.
Yeah, I'll grab that one first, and then Dr. Christie, if you want to follow up, that's great. So we very much appreciate all the mental health counseling type of licenses, including social work. What we know is that to some degree, social work master's degrees overlap with clinical mental health counseling degrees. There are differences in the professional identity. Social workers are often taught to do more community-based resourcing, whereas clinical mental health counseling degrees may have more mental health diagnosis, so psychopathology and assessment courses, as well as a lot more courses requiring clinical skill development. So it's really going to take a review of the transcripts to determine whether it's in the student's best interest to skip right over an integrated degree and go right to an EDD and SPP. The likelihood is that that is the case, that you'd be doing a lot of rework of courses that you already had in a social work program. But again, it's always wise to make an appointment with probably me or Laura and talk through that a little bit.
I'll offer that one of the things that might also help you to make the decision, if certification is something that you're interested in on the sport and performance side, is to reach out to the Certification Council and identify whether LCSW is an approved degree. If you have your degree in social work, making sure that that counts as one of the degrees that that is closely related to sport and performance psychology as far as the council is concerned is a big deal. If licensed clinical social worker and that social work degree actually is approved as closely related, then you don't actually need to get another degree. That degree in social work will fulfill the degree requirements. And then what you're looking for is to really balance out with all of the sport and performance psychology piece. So you might be able to complete the certificate. You might decide on the master's degree to get a little bit more depth. But yeah, so really determining kind of what you want to do and how you want to do it, again, through chatting with Laura, chatting with Dr. Cox, reaching out to the council, all of those things might help a little bit more to get you some more clarity on what will work.
So the next question is in regards to the transferring of credits from external degrees into our programs. So I'm just gonna let you, any of you, to explain a little bit like how is that the process works and how many credits we will be accepting from those external institutions.
So we accept up to 16 quarter credits, but there are some requirements with those 16 quarter credits. So the number one thing is we're going to want you to be admitted to the program. It takes a lot of effort to review transcripts and applications, but you have 3 terms in the program to transfer in those 16 credits. And within your first term, we start walking you through that process once you submit our application form. The real key is that you're going to want to locate and have access to those courses that you think are transferable. We need the syllabi from the time period during which you took the courses you want to transfer in, and any additional documentation that you can provide, because what we're going to be asking you to do is compare our learning objectives for the courses you want to substitute to the learning objectives for the courses that you took. And so that's a process. I mean, we often get 7-8 page documents of here's the application, here's the learning objectives and how they align, here's our transcript. That's pretty normal. The one thing I will tell our applicants is that we are looking to save you money. We are looking to transfer courses in for you if we can. And so our goal is to always find a way to assist you with doing that. The one thing I will also note is that we never accept an ethics course as a transfer course. We think that we are very, very good at teaching ethics, and we want to see those ethics consistently followed all the way through our programs. So we make sure that that is the foundational base for every one of our students in our program.
So thank you so much. And speaking about ethics, so there is a particular question that is about the ethical limitations when it comes to the work of a performance consultant or somebody who has been working with athletes for 10 plus years, and then the person also working as a mental health counselor or an LPC. So if you two can elaborate a little bit on those ethical limitations.
I'll let you start, Dr. Castillo.
Well, I think the reason the question came up is because I mentioned it before. So what I can offer is that the real challenge there is dual relationships. It is not about whether or not the professional, the practitioner, is able to do the work. It is about the perception that the client has when they walk into that room. It is this in the best interest of my client? So when I walk into a room, all of my athlete performance clients know that I'm not a coach. I'm not going to tell them how to approach anything. If I were really good at track and field and working with Paralympic track and field, and sometimes I was a coach and sometimes I was a performance consultant, that really crosses a lot of ethical boundary issues. Who am I talking to? What am I supposed to be listening to, et cetera, et cetera. And again, that's the best interest of the client. The same sort of thing happens when I'm working with both clinical issues and performance issues with the same person. If I'm at a competition and the person that I'm talking about my childhood trauma with, as well as goal setting, is going to watch me perform, who's watching me today? And if I make a mistake, am I going to have to talk about my childhood trauma and how that's impacting it? Or can we just talk about the fact that I didn't prepare well? Again, these are the sorts of challenges that we're talking about. And it's not about whether or not the practitioner can switch hats appropriately. I have every belief that the sports psychologist you mentioned in your question is very able to sort of, all right, now I'm a clinician and now I'm a performance consultant. It's not about the practitioner, it's about the client.
I will add in a very generic way, or from a felt sense, what it is to be a clinical mental health counseling client. When you are bringing painful experience to somebody who you trust to facilitate healing, you want to tell them the story the way you understand it. So when somebody walks into a room, or if we're thinking of COVID, shows up on my HIPAA compliant Zoom screen for a telehealth session, they want to know that I am fully invested in what they have to share, in the way they want to share it, in the time frame in which they want to share it. And that I'm not taking pieces of collateral information from every team member, friend, family, coach, or bus driver from that particular, let's say that's an athlete, that's a client of mine. That is fundamental to the healing process, is that I am able to embed myself in their world in a significantly empathetic way. And empathy doesn't mean I feel sorry for. Empathy means I can understand what you're telling me. And if in fact I cross that boundary as a clinician into performance consulting, that means I am in that person's world or part of their world, watching their performance, watching them among their team members, seeing them with their coach. And it colors my perception of the who of who they're bringing into the room. That is significantly harmful, because a significant portion of what you're helping a client to determine is whether or not they're accurately self-evaluating. I never have to challenge my clinical mental health counseling clients about what they're presenting to me until they present incongruent information about themselves. And then I'll dive in. Then I'll say, wait a minute, you told me you were doing great in this area, but now you're telling me there's conflict in this area. What is happening there? But if I am functioning from two perspectives, both consultant and clinician, I breach that sort of magical bubble of the relationship between me and the client. And what we know is that causes significant harm for clients.
Thank you so much, Dr. Cox and Dr. Castillo. So now we're approaching the end of your presentation before transitioning into the admissions presentation. And my question as an admissions advisor is basically, what are you looking for in a candidate for the doctoral degree or for the master's program in clinical mental health, but also in sport and performance psychology? What are those traits that make an applicant stand out from the rest?
I'll take that first on the sport and performance side. For either one, we're really looking for a passion, a reason that you want to do this, right? Graduate work is hard. Graduate work is expensive. Graduate work requires a decent amount of sacrifice. And quite frankly, if you're looking at an online program, my bet is that you have a life, you have a job, you have a family, you have responsibilities, you have things that are preventing you from packing up and moving to anywhere in the country that has an on-site traditional on-ground program. That means that what's going to be most useful and most valuable for you in completing the program and for us in instructing a program is your passion for the work, your willingness to make the sacrifices that it's going to take. Because none of these jobs, right, both of these, clinical mental health and sport and performance psychology, be very clear, these are mental health professions. And so if you are not entirely invested in the why of what you're doing, it's going to be challenging to get you through the program, as difficult as it is. At our doctoral level, in addition to those things, we're also looking for a way that you want to contribute to the field. We're going to be asking you what contribution you want to make in your research. What questions do you have that you would like to work to provide some answers to? It's not just about getting your education and going out and working. Earning a doctoral degree means that you have a responsibility to give back. You have a responsibility to make the field a better place for the students that come after you. And that professional responsibility begins the day you interview. And so we'll be asking you about how you want to contribute. We're going to be asking you about what things you want to study, what questions you have about the field and about the literature. And we'll help you structure your program and the way that you kind of navigate the courses in your program to helping you answer that question.
Thank you so much, Dr. Castillo.
Yes to everything that Dr. Castillo shared. And then I'm going to add some more on top of it if that's not enough. Let me start by saying that we hear horrific things as counselors every day, all day long. I can't tell you how many times I write what I think to be a pretty benign case study for our students to review. And I will hear students say, oh my God, that's horrific. I can't imagine I'm ever going to hear something like that. And I say, wow, that's mild compared to the things I have to hear every day. The UPS truck is here, you guys. That's really what's happening in my world. And so it requires pretty significant mental toughness and an ability to compartmentalize. Our field requires us to be mandatory reporters 24/7. And it can be very difficult for people to set aside what they're hearing and their experiences as helpers in the world in their regular life. Sorry about that. It also requires a pretty serious mindset as a learner, an ability to be self-reflective, or honest and earnest with yourself, an openness to what you learn from other students and your faculty member, a willingness to be humbled sometimes. And that can be very, very difficult and trying. We're unlike most other professions, not all, but most, in that every day we're evaluating, did I do that right? Did I do that enough? Is there something about me that is getting in the way of me doing good work with this client? And there's never a stop to that self-evaluative quality. We are always pursuing trying to be better people in the world and better clinicians and better consultants. And it requires an internal toughness of both heart and mind. And we're looking for people who have a passion and a calling in that way, because if you don't, you burn out of these fields very, very quickly.
Well, thank you so much, Dr. Cox and Dr. Castillo. So we have approached the end of our session before I transition into the admissions presentation. So thank you so much for joining us today. You're welcome to stay in the virtual chat or just leave. I'm going to now start with the admissions presentation. If you are ready to apply or have more questions, I'll be happy to answer those. So I'm going to start with the admissions presentation. Thank you so much.
Thanks, everybody.
Thanks, everyone. Good luck.
Thank you. Okay, so I'm going to share my screen now so that I can start with the application requirements. Okay. Okay, perfect. So again, if you are ready to apply, so I believe the first step definitely is to schedule a phone advising appointment. You're just welcome to go into the website. We have a specific space designated for you to book an appointment. If you just want to send your questions via email, that will also be fine. If you want to just call our office and get redirected to me directly, so please just call 800-641-5641. We'll be happy to answer any and all of the questions that you have about the application process, or if you are unsure about what program to go for, absolutely, we'll go through that. So we are currently accepting applications for fall 2022 and spring 2023. The priority deadline for fall 2023 is July 22nd. However, we are offering an application fee waiver for those who send their applications before the end of May. So if you want to take advantage of this application fee waiver, please schedule an appointment with me, follow up with an email, and I'll be happy to have a conversation with you and let you take advantage of these. So we're also, what are the application materials, basically? So I'm going to explain that. So we need 2 letters of recommendation. So one of your letters should come from an academic person, a professor, a mentor, a tutor, somebody who can speak of your skills and abilities that will help you to complete this program successfully. And then the other letter of recommendation can come from just anybody, a colleague, a supervisor. We need a resume with basically like a story that will show us what you have done in your field, with your profession, and everything that you've done after you completed your bachelor's or your master's if you are applying for the non-combined doctoral degree. And then we will also ask you to send an essay, an application essay. It's just a basic application essay. When you start the application with us, you'll be able to see the prompt that you need to address. The prompt specifically addresses social justice, your notion on social justice, what are the things that you can sort of like help with in the field, and also your biases as you transition into these particular programs. And then finally, what we will be looking at is your official transcripts from all post-secondary institutions attended. If you are an international student, you will need something that is called an international credential evaluation. I'll be happy to provide with you separately via email the contact information of an organization that will create that report for us, but you will need to go through that process. We need to see that all the studies that you did in your country of origin are similar or equivalent to the ones that we have here in the US, and then you can apply for our program. So for students that are US citizens, students who completed their entire education here, so official transcripts will be fine, unofficial transcripts also will be fine. If you have easier access to unofficial transcripts, you can just send those to admissions@uws.edu and we will just attach them directly to your file. There will be a personal interview for students attending or applying for the master's program. So we will have something that is called a meet and greet session, which is basically like a group session with other applicants for the master's program with a faculty member and the program director, and each one of you have equal time to go through questions about the program. And then for students applying for the doctoral degree, either the combined degree or the non-combined degree, basically you'll have a personal interview. It will be just you and the program directors. And you already met them. Dr. Michelle Cox and Dr. Sara Castillo will be your interviewers. And then after you finish all this process, submitting your application, sending official transcripts, then we will then send you a notification if you have been accepted. And if you are accepted into our program, then you will need to pay something that is called the tuition deposit. So it's $300 that basically will save your spot for the upcoming cohort, either for your master's or your doctoral degree, and will trigger the IT department to send institutional credentials so that you can start registering for classes and just get notifications from student services. So for students who are applying for the graduate certificate, there's no personal interview. You will just have an informal conversation with me one-on-one via Zoom or over the phone, and I will just go over your transcripts and your qualifications to get into our program. If everything is fine, then I will move your application to final review, in which case the program director will go over my notes and everything else that you have submitted in your application package, and then we'll move on to acceptance. If you are an applicant whose GPA is not the best, no problem. So we offer different options for you. So for students entering the master's program and the doctoral program, if your GPA is not exactly what you need, then you will need to enroll or register to take the GRE General Record Examination exam, the general one, and we will be expecting you to score at least above the 50th percentile across all sections. But still, you can take the exam, send us the results, and then we will just go through those with you. And then for students who want to enter the graduate certificate, we have a different process. If your GPA is not the best, please just contact me and I will explain one-on-one how we can handle that. So other than that, if you have any questions about tuition, the cost of our program per credit, how you can finance your graduate education, please feel free to reach out to our financial aid office. So far, the master's program and the doctoral program are entirely eligible for federal financial aid. The graduate certificate program is not eligible for federal financial aid. However, you could ask for some form of tuition reimbursement through your employer. We have dealt with those kind of cases before, so please reach out to the financial aid office and they will be happy to provide more guidance. We also have lots of payment plans available for you. If you're just paying out of pocket, please contact our financial services, the business office, and they will be happy to answer any and all the questions that you have about that. So thank you again for joining us today. This is the end of the admissions presentation. So again, if you have any other questions, please feel free to schedule an advising appointment, send me an email, and I'll be happy to get back to you. So thank you again for joining me. Have a good day.